This lecture is about peripheral line infection. Peripheral line infection is important because it increases morbidity and mortality. It increases antibiotic use because we need to treat these infections, and it increases hospital length of stay. So preventing peripheral line infections is a very important part of antibiotic stewardship. Prevention is the key. Most peripheral line infections can be prevented by simple measures. Always use aseptic technique when inserting a cannula. Try to make an early intravenous to oral switch for antibiotics, medications and fluids. And promptly remove any unused cannulas. The definition of peripheral line infection is acute inflammation of the soft tissue surrounding a peripheral line site. The likely pathogens are Staphylococcus aureus, which might be methicillin sensitive or resistant, coagulase negative staphylococci, and streptococcal species. In terms of management, the first thing to do is always to remove the line. Then you must assess the severity. If there's only a small area of erythema, this may settle purely by removing the line and no antibiotic treatment is necessary. If there's a large area of erythema but the patient is systemically well, a reasonable choice of antibiotics would be clindamycin given orally for 5 days. You should upscale to clindamycin in a patient who initially is given no treatment but deteriorates. Importantly, if a patient is systemically unwell with a SIRS response, there's a possibility that they have a bloodstream infection. These patients should have a blood culture sent and should be started empirically on intravenous vancomycin with a loading dose. Similarly, patients on clindamycin who are not responding should be upscaled to vancomycin. If there's no response to vancomycin, you need to look for collections and drain them if they're there. Ensure that there's adequate vancomycin by taking trough levels and repeat the blood culture. So in summary, most peripheral line infections are preventable by simple measures. Always remove the line if inflammation is present. Antibiotics are only required if there is a clear area of cellulitis. If the patient is systemically unwell, they may have a bloodstream infection and should have a blood culture and receive empiric therapy with vancomycin.